I'm Doctor Veda. It's very nice to meet you. So tell me what's bringing you in today. What's going on with your ears? Okay. Yeah. So the irritation, is it itchiness, pain? What kind of sensation? Okay. How long has that been going on? Yeah, okay. I'm gonna start by getting a really good look at your ears, alright? So I'm gonna come in a little bit closer. I have my otoscope here with a fresh tip on it. I'm just gonna get in your ears, okay? Okay. Just go in a little bit here. Just take a look in your left ear to start. Okay. Yeah, so first off, I can even see the outside of your ears very irritated. Just look inside here. Okay. Alright, does it hurt when I put the otoscope in your ear canal? Okay, I'm gonna be very, very gentle because I can see a lot of irritation. Oh, okay. Yeah, a lot of redness. Oh. Not much earwax, but boy, is that red. I can definitely see where you're saying it's painful and itchy. Okay. Just get a good look at the outside again. Yeah. Okay, come back in here. Alright, just get in. I'm just seeing if I can detect any damage to the tympanic membrane, eardrum. Okay. Okay, that's good. From what I'm seeing, the eardrum looks okay. It's just the canal itself looks really inflamed and irritated. Okay. Yeah. And you said this has been going on for weeks? Okay. Oh, you poor thing. Has it affected your hearing at all? Yeah, it seems to have. Okay. And, let me check the other ear now. I'm just gonna come in here. Just come in really close again. Look at the outside. You said it is both ears. Okay, and I am definitely seeing that it's both ears. Oh yeah, just so red and irritated. Inflamed. I'm gonna come in again. I'm gonna be very gentle. Because I know it's quite painful. Okay. Yeah, I'm seeing the same over here, just a lot of redness and irritation. Alright. Just get in and take a look at the eardrum again. Make sure that there's not any damage. That's one of the big concerns when I see something like this. Worried about damage to the eardrum or some inner ear issues. Okay. Okay, yeah, that looks okay. Good. Okay. It's just so red. Alright. Not a lot of earwax at all, really. Almost none. You've been using home remedies, right? Okay, yeah. What sort of home remedies have you been using? Is it like drops from a drugstore or something to try to alleviate the pain, something to treat an ear infection? Okay. Yeah, what kind of essential oils? Okay, and what are you using as a carrier oil for that? utilizing essential oils, I don't recommend putting them in the ears anyway, but most of the time people will use a carrier oil in order to dilute them. So I'm very concerned that you've been putting undiluted essential oils in your ears. Really, again, I don't recommend putting them in your ears ever anyway, so we need to stop doing that. Okay. No, I totally understand that. Really, you're just kind of desperate to get some relief. So I totally get that. I know. Where did you get the oils from? Okay. Did they tell you? They told you to use them in your ears? Okay. Yeah, we're definitely stop that. So we're not gonna do that anymore. But again, I totally understand why. Not judging at all. You were just really trying to find some relief from this, because I can tell you were really suffering. Yeah. Just getting a really, really thorough look. I don't always spend this much time in there with the otoscope, but I really want to make sure that I'm not missing anything before I try to treat this, because I do have an ointment that I'm going to use on you today, as well as sort of a lotion for the outside of the ear. It's 2 different products, and I'll be able to send you home with them, but I just want to make sure that I'm not seeing any counterindications before we use it, because I don't want to cause more harm. Yeah. Just gonna get in here a little deeper for a second. I'm sorry, I know. You're a trooper. Okay. Yeah. Okay, I'm really, really relieved that I'm not seeing anything with the eardrum. And I'm hopeful then that some of the hearing issues you've been having are just because of the inflammation and sensitivity that you're experiencing. Yeah. So my thought is that this is probably just a routine ear infection that has been sort of exacerbated and really irritated by the essential oils. So the drops will treat the infection as well as sort of treat that damage to the ear and help you with that. You should also feel almost immediate relief from a lot of the pain and itching, and yeah, I think that'll help. In terms of the hearing issues, I am going to do a few hearing tests today, but it's likely that you'll need to come back. I want to do a follow-up with you in order to make sure that there's no permanent hearing issues, but I don't expect there would be, so I don't want you to worry about that, okay? Just grab my notes here. Okay. I'm going to take a few notes about the appearance of your ears from what I've seen inside, and then some observations of the exterior, okay? So I'm just going to come in here. Okay, so we'll look at your left ear first. Left ear. Right. Okay, redness. Swelling. Your earlobes look okay. So it's really just sort of the shell inside of your ear that I'm seeing most of the irritation. And then a little bit on the ear itself as well. Were you using the oils on the ear too? Yeah. So mostly inside, but also on the exterior. Okay. Yeah. Just trying to get a gauge for the size of that. Another good thing is that you do not have any open lesions, so that's good. I do believe if we had continued with the treatment that you were administering, that it probably would have progressed to that point, so thank you. I'm so glad you came in. Okay. Okay. Yeah, that's good. Okay, so really just a lot of redness and swelling, but luckily no lesions. Have you had any bleeding at all? Okay, that's good. That's really good. Okay. Just look at the right ear. Okay. This one does look a little bit worse. Did you treat it more frequently or anything? Okay, so we started earlier on the right ear that seemed to be infected sooner and then progressed to the left ear as well. Okay. Yeah. Again, no lesions, no blood. Smelling of the auricle eardrum. Fine. Okay, the lobe slightly red, mostly normal. And just gonna get one more quick look inside the ears to write my observations. Come over here. Okay, yeah, redness, swelling. Yeah, nothing with the eardrum. I'm just so concerned about that. That's good. Okay. One good thing is that it's not like you have like scratches in there. So were you just using like a dropper and putting it in, or were you using a Q-tip? Sometimes a dropper, sometimes a Q-tip to sort of move it around. Gotcha. Okay. Just gonna come back over here to the right ear. Sorry, left ear. My right. Okay. And then the right ear. Use dropper of oil, no carrier. Did you try any other home remedies? Okay, so just the oils. All right, that's good. At least we're not contending with multiple facilitating factors, so that's good. Okay. I'm just gonna very, very gently, I have a stick here, very gently going to touch different parts of your ear, and I want you to let me know how sensitive it is, if it hurts at all, anything like that, okay? So when I stroke right here, how does that feel? Okay, it's just a little bit. Okay, and how about right here? Alright, so not too bad, just a little bit. Okay, and over here, when I do right here, how does this feel? Okay, no, I won't do it more than once then, alright, if that was painful. How about right here? Okay. So not too bad right there. Okay. How about right here? Okay. Now, if I let me get a fresh one here. I'm gonna go in very, very gently in the ear canal, and I want you to tell me if this is very painful for you. Okay, so I'm just gonna come in here, very, very gently and delicately with the cotton swab. Again, do not do this at home, okay? We don't want to put Q-tips in the ears. You don't really want to put anything in the ears that's not prescribed to be in there. So I'm just gonna very gently come in here with a Q-tip. Okay, so not too bad. Oh, okay, so it's almost kind of scratching an itch too. If I press a little bit more. Okay, so that gets slightly painful. Okay, I won't do that again. Come in here a little bit. How about right here? Okay, yeah. Grab a different one here. I'm going to come into your right ear, same thing. Again, I'm going to be very, very gentle, especially with this ear, because I know it's a little bit more irritated than your left. So we're just going to come in here very carefully. Okay. Okay, so that's pretty sensitive. Okay. How about right here? Okay. Sort of that scratching and itch sensation. Is it tickly at all? Okay. Alright. Yeah. I don't want to do that too much or go too deep because I do not want to cause you any pain. So just make some notes about that. Minimal pain outside of ear. Left ear. Less severe. Right ear. More irritated. Inside, more sensitive than exterior. Okay. Right. I'm gonna do a couple little hearing tests just to gauge the hearing loss that you're experiencing. Are you also experiencing any ringing in your ears? Yeah, okay, it's ringing. Any crackling sounds, bubbling sounds, maybe water? Okay. How about static? Alright, so when things get loud, is that okay? Now some of these are symptomatic of ear infections in general, but I do think it's just something where the treatment that you were doing has exacerbated it. So that static thing too, that can happen with loud noises. So I'm gonna try to avoid loud noises for now. I would ask you to please avoid wearing headphones of any kind over ear or earbuds, especially earbuds. But I want you to even avoid over-ear headphones right now, just because of the condition that your ears are in and with the hearing issues you're having. I don't want you to accidentally cause more hearing loss by increasing the volume on your devices. So we kind of just have to let it be for now and treat it, and then you can go back to your normal routine if you usually use headphones or earbuds. I know it's really unfortunate, but it shouldn't be more than 2 weeks while we're doing the treatment, okay? Alright, so I am going to say some words, actually some numbers, I'm going to say a string of numbers into your ear. I'm going to try different distances, different volumes, and I just want you to repeat them back to me and also let me know how difficult it was for you to understand what I was saying, okay? Alright, I'll start over here. 146821. Okay, and was that pretty clear? Okay. 532984. Okay, good. And the clarity? Okay. 151232. Good. 865229. Okay, good. So is the whisper a little bit more difficult? Gotcha. Yeah, okay. How about from further away? 930426. Good. Okay. 951232. Okay. Good. 812622. 142659. Okay, good. 231467. 952123. Okay, I'm going to move back and forth between the ears as well. Let me know if it's harder to hear in one ear than the other. Okay. 1423 172. Okay. 95261 473. Okay. 1457269. Okay, I'm gonna slow down just a little bit now, okay? 4 2 7 8 4 7. Yeah, 427847. Okay, now you were close. All right. 4 5 6 3 9 4 2. Good. Okay. So slower is a little bit easier. Yeah, okay. 984726. 193245. Okay, I'm gonna come back in. 924653. Okay. 829245. Okay. So, with what we've done so far, I kind of get an idea by the answers you're giving, but does it seem easier to hear and comprehend a whisper or spoken voice? Okay. Closer or further away? And do you feel like it's easier to hear and comprehend with your left ear or your right ear? Okay. Yeah, I would agree. It seems pretty even, but the right ear does seem to be a little bit more affected. Okay. Alright, now I am going to say a word twice, and I want you to know whether, I want you to tell me whether it sounds clearer the first time or the second time, okay? Alright. brittle, brittle. First one or second one clearer? Okay. Apostrophe, apostrophe. Okay, good. Leftovers, leftovers. Okay, good. Thanksgiving, Thanksgiving. Okay. Pizza, pizza. Okay, good. Penne, penne. Yeah, that's penne, penne. Okay. Dog, 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 dog. Okay. Tarantula, tarantula. All right. Wolverine, wolverine. All right. Quesadilla, quesadilla. Tacos, tacos. Okay. Snack, snack. Castle, castle. Okay. Very good. All right. It does seem like your hearing has been affected, but it doesn't seem too bad. It doesn't seem that severe, so that's really good. And I have every reason to believe it will return to normal after we treat the infection. Okay. Excellent. All right. So here's what I'm gonna do. I have this oil. It's not an essential oil. This is a medicated oil. Goes in your ears. Rather ointment oil. And this lotion for the outside. If a tiny bit of the lotion gets inside, it's not going to cause any problems, but don't apply it to the inside purposefully, okay? This is for the inside, this is for the outside. They have the same active ingredient. It's just a sort of carrier method of application. Alright. So I'm going to do your first treatment right now, and I'll show you exactly how to do it. Go ahead and put some gloves on. And this does have a pain reliever in it as well. That should help with that itchiness and irritation. Really, you should have some immediate relief from it, and then it will get better and better over the course of the 2-week treatment. Alright, so I'm going to start with the oil. We're just going to put this in your ear with the dropper. I'm going to have you tilt your head just slightly to the side. You don't have to be aggressive with it. I don't want to make you uncomfortable. Okay. And as you can see, this is like an oil. It's not super thick, but it's thicker than just like a water. So it'll sort of coat in there. We don't use too much because I don't want you to feel like it's like swimming around in there. Okay. So I'm going to come in here. We'll start with your left ear. And I'm just going to go ahead and very gently drop her a little bit of it in, okay? and it does come out just a little tiny bit at a time. It's not a normal dropper, so you can really put several drops in. Just little tiny drops, okay? Just a little bit more. Alright, good. And then we'll come over here to your right ear. I'm going to do the same thing. Have you tilt your head again, okay? Oh, get a little more. I did not get enough. Excellent. So that's all you need. I know it sounded like a lot, but it doesn't feel like there's that much in your ear, right? Okay, excellent. Okay. So I think probably about 20 little drops. Again, they're very controlled, so it's a really small amount. If you want to, you can just sort of do it on your hand once to see how much actually comes out, because it's very little. Alright. And then this next part, actually, I'm going to put it on with the gloves. You do not have to use gloves with this at home. You can use your bare hands. Just make sure they're clean. So wash your hand before, and then you can use your hand for this. So I'm just going to go ahead and put a little bit on here. Just that much should work. And I'm going to go ahead and massage this into your ear, okay? Very gentle, because I don't want that to be painful at all. It should be soothing. Okay, good. Alright. Then we'll get a little bit more for the other ear. Same amount. You don't need that much. Come in over here. Good. Okay. Yeah, it's sort of really nice and cooling and soothing. Let's get that all in there. It should absorb very quickly, so you're not going to walk around with sticky ears or anything. Alright. There we go. Get that over there. Okay, so that's it. Again, I'm going to use this. Use this twice a day for 2 weeks, and then this as well, twice a day for 2 weeks. I suggest using them at the same time. Generally, I would do it when you wake up and before you go to bed. These tend to be the best times, and then it's sort of equally spread throughout the day. However, if you're only getting like 5 hours of sleep, try to do it at least 10 hours apart so that we're having an even distribution throughout the day. Yeah, I know you probably don't get 10 hours of sleep, so about 10 hours apart at least. Okay, twice a day. And I'm going to schedule a follow-up appointment for you. 2 weeks to check back on your ears, and also I'd like to do a full hearing test at that time to make sure that you don't have any long-term side effects from this. Again, do not expect you to. Want to make sure that you're going to be okay though, okay? So 2 weeks, that would be, let me see the calendar here. Oh, I know most places have the front desk do it, but can do it while you're right here. 2 weeks. 20th. So the 20th, would you be available on that date? We have a 10 a.m., 2 p.m., and a 3 p.m. that appointment is going to be just a bit longer because I do have to do the full hearing test, okay? So take at least an hour. Expect to be here for about an hour. Okay. It doesn't always take that long, but just in case. I know some people expect to be able to go back to work really quickly, so I don't want you to think it's just a quick checkup. Make sure that your ears look good and you go. I do want to do the full hearing test, so. Alright, 2 p.m. on the 20th. I'm going to get these in a bag for you. You can go ahead and take them home. Start the treatment tonight because we've already done the one this morning. And twice a day for 2 weeks. I'll print out the instructions for you as well. And an appointment reminder card. You'll also get a text to remind you, okay? Alright. No, I'm really, really glad you came in. No more essential oils in the ears, okay? Alright. And if you feel comfortable, I would even tell your friend if you feel comfortable, the effect it had on you, so maybe she doesn't tell other people to do that in the future. Okay. Well, it was lovely meeting you, and I'll see you in 2 weeks.